Hey, beautiful soul. You're listening to the Rising into Mindful Motherhood podcast, your weekly dose of fertility wisdom. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, and integrative fertility coach. This is your go-to podcast for all things to naturally nourish your fertility, embody womb healing, and reclaim your feminine power to accelerate your path to pregnancy. My expert guests and I will be having intentional conversations to discuss the many facets of a thriving, fertile foundation, natural wellness, and how we grow and transform as women on our journey to motherhood. So let's dive in, shall we? Hello and welcome to Rising into Mindful Motherhood. In this episode, I'll be talking with Abbie Bradford, a registered nurse, functional diagnostic nutrition practitioner, restorative wellness practitioner, and clinical herbalist, specializing in gut health and eczema in children. She has a passion for helping families live holistically and allowing children to live their true purpose through root cause natural approaches. She has a thriving online holistic program helping parents eliminate their children's eczema for good naturally. Now, my nephew has eczema, so I'm actually excited to learn from you today. And in today's episode, we'll be discussing the connection of mom and dad's health to their children's and how you can prepare for conception for optimal child health outcomes. So welcome, Abbie. Excited to touch on this new topic today.
Yes, thank you so much. There's a lot to dive into, so I can't wait.
Yeah. So for anyone who, I'm sure they've heard the term eczema before. I feel like it's used quite a bit. It's quite common. Children and adults alike have it. But what is eczema exactly? And then after that, maybe we can dive into what some underlying causes of eczema are.
Absolutely. Yeah. So eczema is really a diagnosis based on symptoms. There's no real blood test necessarily or anything. Doctors are really just looking at eczema and looking at a consistency of symptoms of red, itchy, raised kind of rashes on the body, and they can be anywhere on the body. So they can be behind the ears, on the head, it can be ankles, it can be anywhere in their kind of groin in the diaper area, it can be legs, all that stuff is all eczema. And really, I say that it's more of a symptom. So the way that I view eczema is that eczema is really just the symptom, and it's a cluster of symptoms essentially that give a diagnosis, but there's really other things underlying there going on. Eczema is basically the body's way of pushing things out through the skin that are not being able to be eliminated otherwise. So internally, we know that there are all these different drivers, and they can be things like nutritional deficiencies. There can be a lot of gut stuff going on, and that's where we'll focus today, probably because that is like 97% of where these problems come. And there can be all kinds of things going on in the gut that are really pushing out through the skin. And that can cause food issues, food sensitivities, even food allergies. It can cause even things like asthma and severe environmental allergies later on and things like that. And it can continue to go on. I mean, even like doctors will say they'll quote, grow out of it. And we know that they actually don't grow out of it, even though the eczema symptom might decrease or go away, which doesn't always happen, by the way. There are still those underlying things going on that can cause things later, like focus issues, ADHD issues. Later in life for women, it can be hormonal issues and so on and so on. So there's a lot kind of going on underneath there.
I love that you talk to it as a symptom and not necessarily the disease itself, right? There's a lot of factors underneath because I think a lot of times it's just, oh, I just have like bumpy, itchy skin. Like that's all it is. But no, that's just like the tip of the iceberg that you can see above the water when really there's just so much going on underneath the surface as well.
Literally. I mean, that's the exact analogy that's best used because there's this little tip that we can see, but there's all these things underneath that are driving it that we can't necessarily see because they're internal. And we can test for a lot of these things, but it's not typically something you're going to find in a regular Western med office just because it's not really within their training or in their awareness.
And as a pharmacist who used to work in retail, I mean, I can tell you that all doctors are really going to prescribe are just creams and topicals, maybe a steroid if it's really, really bothering someone and affecting their daily living, like for a temporary period of time, but definitely not diving into the root cause. And even dermatologists, and I know this because, like I had mentioned, my nephew has eczema and there are other things going on. But yeah, Western medicine does not touch on those root causes whatsoever. So I love the work that you do. And you had mentioned that gut health, you said like in the high 90 percentage is a big factor for eczema. So let's talk about that. I'm curious if the gut health of the parents has anything to do with children then also having gut health issues, which can then stem to eczema as well.
Yeah, yeah, this is a really, really important topic because it's not something that's necessarily just genetic. It's something that is definitely passed down from mom and even dad a little bit to baby. So let's go into kind of some of this a little bit more root cause specifically. So inside the gut, there is anywhere between, depending on what research you look at, 70 to 90% of the immune system. And so if things are passed down from mom, or dad that are things like a yeast overgrowth, any sort of fungal overgrowth. It could be not enough good bacteria. It could be there's too much bacteria. Even if it's good bacteria, too much of it can cause an issue. There can also be pathogens, which shouldn't be there at all. There's all these different things. There's more than that that we can look at and see what is going on. And so when babies are growing inside of mom, they are forming their microbiomes. Their microbiome is the makeup of all of those things that I just mentioned, all of the good bacteria, all of the maybe not so good bacteria. There's a little bit of that too. And it doesn't just appear out of nowhere. I mean, mom got it from her mom and so on. And of course, there are environmental things that as we grow older that can impact those things too. But definitely a large percent of baby's gut is coming from mom's gut and vaginal microbiome. So definitely when baby has something, especially when it's right from birth, we're thinking about what did mom have? And did baby get antibiotics right after birth? Did mom get antibiotics during labor? Did she get antibiotics during pregnancy at all? What's her antibiotic history before going into preconception and conception? What is her history with UTIs and yeast infections and all that kind of stuff? Because those are all clues into her own microbiome and what's going to be passed on to baby. And so when this little human comes into the world and the bucket of what they can handle is so small, those things are just way too much for their body to handle. And so even though in mom, they may have the same overgrowths as baby and it's not presenting like that for her, in the child, these things are definitely overwhelming the systems. The bucket of what they can handle is, I don't even know the actual percentage. It's probably 5% of what mom can handle at that point, meaning that these overgrowths are giving off different things like toxic byproducts and things, and it overwhelms the system. It overwhelms the liver, the kidneys, and it comes through the skin. And so many times it's coming through the skin and their little bodies can't really handle it. And like I mentioned, some docs will say, well, they'll just grow out of it. And like I said too, that is not always the case because what happens is their body gets bigger as they grow to be 2, 3, 4, 5. Their body gets so much bigger, and so they're able to handle a lot more. And maybe it's not coming through the skin anymore, but a lot of times it's still there causing other issues. So we definitely have an opportunity thinking about, especially in that preconception phase for mom. What is her gut health? I mean, that is such a crucial time to be able to really make an impact and stop that from continuing on into even if she already had a child into the next child. It's like we can stop this before it really gets to keep going on generation after generation. And genetics are a very small part of this. Yes, there are some genetics at play, but by far these things that we can control are playing more into it than anything else.
Mhm. Absolutely. So, for someone who is pregnant, but I also feel that it's important to start these practices before you get pregnant, what are some tips you have for them to improve their gut health? Using our 4-step restorative fertility framework, we will, one, reveal the physical and energetic root cause. 2, we will remove the barriers to you conceiving and carrying a pregnancy to term. Number 3, we will rebalance the physical and energetic body with bio-individual strategies. And number 4, receive. You will nourish the mind, body, and spirit so you can receive baby. I have 3 one-on-one spots, and this is for the woman who is ready to claim her fertility back. She's ready to step back into her power. She is ready to do what it takes to finally get pregnant. If you want to learn more about this, find me on Instagram at @the_wellness_pharmacist. My Instagram is going to be in the show notes.
Yeah, so there's a couple things that are absolutely possible during pregnancy. We don't want to be doing any eradicating, meaning we're not trying to kill yeast, we're not trying to kill bacteria. If they tolerate a probiotic, that can be really great, especially if they can do one that's helpful for yeast called Saccharomyces boulardii. That can be really great. Always go slow with everything because even a probiotic, which isn't technically like an herbal antifungal or anything, it can still have that effect on it. So go really, really slow and always open the capsule up and just put a little bit on either a little bit of water or some food or something, and you can take that. But that is something that we want to be thinking about shifting that microbiome in a positive way. Now, for some reason that causes any issues, like some probiotics cause bloating in people, and that can mean that maybe there's too much bacteria in general. Sticking towards one that is a little bit more friendly, like a spore-based one, which is just going to really help shift things in the positive direction without actually putting more bacteria in there. So a spore-based probiotic can be really helpful. We're thinking about food too in a lot of ways. In that first trimester of pregnancy, it's hard because a lot of women just want carbohydrate stuff, and that's all that we can tolerate sometimes in that first period. And that's okay. I mean, you absolutely have to do what you can. But as we're getting into a little bit more of those maybe second stage of pregnancy where we're thinking about widening our plate a little bit, we really want to be focusing on not doing a lot of those really processed foods because really processed high starch content foods are going to feed any of those overgrowths. So we want to think about really getting enough protein. We want to think about making our meals well-rounded where we are getting like some good fiber and we're getting good protein and we're getting some really good fats. Sometimes we forget about those fats and those good fats, and that can be really, really helpful to keep things at bay in a better balance. If there's any sort of acid reflux, those kinds of things, even if there's not, doing a digestive enzyme can be really helpful. And that's just ensuring that we're breaking down, we as in whoever's pregnant is breaking down that food enough so that it's not causing issues down further. Because what can happen is if for some reason we're not breaking down that food, those undigested protein particles can cause inflammatory issues and can cause a leaky gut type situation where it's breaking holes in some of the gut lining down farther. So those two things are probably the most important that we can do. Of course, if we can avoid antibiotics, usually that's going to be helpful, but sometimes we can't. I don't know if you talk about in pregnancy, like the strep issue and group beta strep and getting antibiotics for that, but a lot of times that can actually be avoided. And I always tell moms to get a second culture, get another test. Like you can take a probiotic, you can do some things so that when they test again, that you a lot of times will come back negative. Really important because there's so many kids that I see that mom doesn't really have an antibiotic history, but she did get antibiotics for group B strep, and that seemed to change from child to child. One child didn't have any eczema, the next child did, and the only change was that one antibiotic course that she had in pregnancy. So we know that it does have some effect. Hopefully those things are helpful.
Yeah, and I'd be curious, what are your thoughts on a nice Greek yogurt and the natural strains that are typically found in that? Is that something you would recommend?
Yeah, so we think about natural fermented foods, even if it's like beyond yogurt. They don't have a ton of probiotics in there, although there are some. So it can be helpful to do some fermented foods. I find that when we're really trying to heavily influence the gut microbiome, that probiotics are just a little bit more, quite a bit more concentrated. So I would say that that's important. The one that I was talking about, Saccharomyces boulardii, is really unique in that you're not going to find it in foods. You're not really going to find it just naturally in things. I mean, it is, but not in those types of fermented foods. And it really has a positive effect on, like I said, it's a yeast eating yeast. And so it can be really powerful because a lot of moms get yeast issues and different things during pregnancy. And then that can be a big issue with eczema. So yes, you can do things like that. And I think we also need to have a little bit of a heavier hitter in there.
Sure, sure. And I'd be curious on your knowledge and your research and everything. So let's say mom ends up having a C-section. Do you find that, I think it's called seeding, is helpful for the child's gut microbiome? Curious if that helps prevent things like eczema, but then of course you need to take into account mom's gut health as well. Seeding is going to have that benefit, but is her gut health in a place that will be beneficial too?
Yeah, we do think of C-sections being a loss of that inoculation, right? So when baby goes through the birth canal, they get inoculated with all of this potentially good bacteria. And so if they don't have that, it's really easy to get single strain probiotics that are made for infants and give that to them as well. So you can literally just take your finger, get it wet, put it right along like their gum line, maybe before a feeding or something. And that is really easy for them to do to get the good bacteria. Because, yeah, we don't always know if mom's gut health is maybe in the place that we want to be seeding it, it's maybe situational, but really easy to do an infant probiotic, even if it's not every day. A lot of research is saying that that's beneficial regardless, just to help their microbiome develop. In the first couple years of life, they're really developing these different strains in there, and different strains are taking over. And we just want their immune system to have the best chance possible to be able to fight what needs to fight and not more than that, right? So we want them to be able to have all the good things that probiotics do. They do so many jobs for us. Those good bacteria, they digest our food, they help us make B vitamins. They really break down a lot of these particles and make actual nutrients for us, along with just keeping us healthy and helping our immune system. So we can do that. It can be really easy to just have a little probiotic. I don't know if you can do brands, but there's a couple of them. Smidge, there's a Smidge infant, and then there's also a Plantadophilus by Transformation Enzymes. Both are single strains, and those can be great.
Awesome, awesome. And of course, I feel like we have to touch on breastfeeding as well. I cannot remember the name for the life of me because that was like 5 years ago for me, but there is something in the breast milk that feeds a good bacteria in the gut, if I'm remembering correctly. So,
Yeah.
yeah, I'd love to hear your thoughts on like breastfeeding and how that can also support baby's microbiome. Mom can still influence her breast milk as well. So, yeah,
Yeah.
tips on that.
Gosh, there is nothing in nature like breast milk, really. And no shame to any mom that just can't and they have to use formula. But of course, if at all possible, breastfeeding is an absolute gem for them. It is literally golden milk because it's got all these different things in there. One of the things that you're talking about is called HMOs, and HMOs are basically something that is like a prebiotic for baby. So it really helps to feed the good bacteria and encourage the good bacteria to flourish. And that's really important. The other thing that can happen is when baby directly nurses from mom, that her body is able to change and influence what the baby needs based on its saliva. And so the saliva is giving mom this feedback of what it needs, and it can change things based on what the immune system of the baby is doing, which is absolutely incredible. And again, if you can't directly nurse, of course, there's times when that is not possible. But if at all possible, it is one of the best things nature has given us. And we honestly, I mean, yes, you can buy HMOs, you can buy things that you can put in there in milk or in formula. We just can't exactly replicate it like nature does.
Absolutely. And I feel like we've talked a lot about mom, but you did mention earlier that dad does play a role. So let's talk about that factor and what the male partner can do to really get their health in a position that's going to help support the health of their future children.
Yeah, we used to just say it's all about mom and it's only her gut health and that sort of thing. But there's some new research that has come out actually this year showing that dad's microbiome has a pretty good influence on baby's microbiome. So we think about, yes, the baby's growing inside mom, but dad does put his seed in there too. Literally, his seed actually has different things in there that is going inside mom and influencing her. And that is a big part of it. And really, ideally, dad would have a preconception phase as well and do a little bit of gut healing or looking into anything. Of course, if dad has any sort of skin issues, any chronic issue like that, even specifically in the gut tract, of course, we want to address that beforehand. And we usually say about 3 months before conception is perfect timing. Let all these cells rebuild and our gut lining cells rebuild very quickly, about every 7 days, but just thinking about what we're putting into our bodies so that we get 3 solid good months of the best health that we can have before conception. So it's the same with mom. I mean, it'd be nice if they could go on that journey together. And sometimes it does require looking into it with a test, with a practitioner, and looking at what's going on here because naturally a lot of this stuff is just not common knowledge. It's complex. Gut health is complex in a lot of ways, and especially if there's any other skin conditions going on or other things like psoriasis, there's actually more of a liver involvement. And so there's so many things that we can do about that. And sometimes it does require practitioners' help. But I mean, the main thing is we're trying to get a lot of different toxic products out of our lifestyle in general. So that's the things that we put on and in our body. It's the things that we cook with. It's the things in our environment. Cleaning up our air and water quality are huge, making sure that those things are really big. And so then we're not passing on those things to the child as well.
Mhm. Yeah, 100%. And I I feel like dads need to be included more in the equation. And it's also very helpful for mom to have dad being involved in the preconception health as well and all those things. So I'm just thinking of any listeners who might just be listening in and taking notes here. What would you say are some signs that maybe would indicate that mom or dad or both should really be giving their gut some TLC and just their health in general?
There are some things that are very obvious and direct with that right in the GI tract, right? So we're thinking about any sort of acid reflux, bloating, irregular stools, too soft, too loose, too hard, not enough, not often enough. So you really should be having 1 to 2 really good solid bowel movements per day. If you're not, there's something that's a little bit off there. So those kinds of things can really tell us. If you're bloated and really tired after meals, there's something going on there. You shouldn't ever, ever have acid reflux, even if you eat tomatoes or something acidic, something's going on that is likely could use some help, some attention. Some things that are maybe beyond the GI tract we're thinking about are not directly signs in the GI tract, any sort of skin condition, whether it's acne or rosacea or eczema or psoriasis or any of those things, that's something going on there as well. Really, most chronic conditions have a root in gut health because of the immune system involvement there. So, because there's so much of the immune system in the gut, it can influence any and every system in the body. I mean, beyond something like back pain, I don't know that there's anything that isn't related to gut health in general. So, any sort of chronic condition that we're thinking about, autoimmune, that's a big one too. That's a little bit deeper involvement, but anything that really isn't resolving, we've got to look at the immune system and what's really pulling on the immune system.
Hmm. Very helpful. Thank you. Is there anything else that we didn't touch on? I feel like this is such a big topic, and I like to try to like ask questions that I feel are good ones for the listeners. But if I missed anything, please.
Yeah, I guess in general, I would just something that maybe is not common knowledge about eczema in general is just that it can 100% be eliminated for good. And if there's still flares happening, if there's still something going on, if they had cradle cap as a baby and you're still seeing that they're a little bit older, even 2, 3, 4, 5, and they still have this dandruffy looking thing. There's still something going on there that we can have control over, that we can help them. And helping them when they're young is such a good thing because it literally ripples throughout their entire life afterwards. So there's this snowball effect that happens that really starts at birth or can start at birth. And we have the ability to stop that at any point. And we don't have to blame genetics, and we don't have to just continue to use steroids and band-aid those types of things because steroids are just a band-aid. You stop using them, they don't work anymore. You don't have to take heavier medications. I mean, some doctors will offer injections and other things like that. So there are all of these things that may be scary, and you go to your doc and they're offering you, and just know that you do not have to take those. There are other options, and even if the doc tells you gut health is absolutely not related and has nothing to do with eczema, I'm sorry, but that's just not true. The research says differently. And if they don't know that, then that's just a lack of their own understanding and own education. And I think that can be really intimidating for parents. But I think that the more that we empower ourselves with these things that are outside of the Western knowledge and awareness, the more that we can really help our kids and find real answers, because there are real answers. And I think the more that we can just shout that message is that the body always wants to heal. And so if it's not able to heal, something is still being missed. Something is going on. If you think you've tried everything, something is still missing, and we can absolutely dig in and find that.
I couldn't agree more with that statement. And yeah, just feeling comfortable and empowered to advocate for yourself and your children and know that you do have other options. I think that's really important to know. And I know you have an amazing freebie for the listeners if you want to share about that.
Yeah, absolutely. It's called the Step-by-Step Guide to Eliminate Eczema for Good. And it's basically just looking at all the different areas that we can positively influence. So there's lots of good, tangible pieces in there about how we can look at our environment and lifestyle and diet and get into the root cause of some of these things that can really trigger it. Happy to give that over. There's lots of good stuff in there, so I hope they take a look.
Yes, and the link for that will be in the show notes. And let us know where the listeners can find you, connect with you, and learn more.
Yeah, absolutely. I would say the best place is probably Instagram. I'm just underscore Abbie Bradford. So they can find me there, message me there. I'm happy to talk with people about their situation and what maybe some of those missing pieces might be. And I do offer a program where I walk through all of this with parents and do testing and dig deeper into that. So we can always go that route as well.
Amazing. Thanks so much, Abby. It was a great conversation. I know it's going to be really insightful for the listeners, and just knowing that you do have the ability to change things in a positive way. So thank you so much.
100%. You're welcome. My pleasure.
Thank you so much for tuning in to the Rising into Mindful Motherhood podcast. If this episode resonated with you or gave you an aha moment, stop what you're doing right now and write a review. This simple act of kindness helps me get this podcast out to connect with as many women as I possibly can. I also have a special offer. If you send me a screenshot of your review, I will take $250 off one of my premium coaching containers. Let me know what resonated with you the most and why. So connect with me in my free Facebook community or tag me on Instagram. You'll find both listed below. Thanks again from the bottom of my heart for tuning in to this episode, and I'll see you next time.